So, a very warm welcome from all of us in the Irish Cancer Society. My name is Dr. Robert O'Connor, and I'm the Director of Research for the Society. The coronavirus pandemic has turned much of our lives upside down recently, and we know that there are many people with questions about cancer and cancer treatment emerging at this time. To help us answer some of these, I'm delighted to speak with Professor Donal Brennan. Professor Brennan joins us from the Mater Hospital Dublin, where he is a consultant cancer specialist and also the UCD Professor of Gynecological Oncology, not to mention his stellar international research experience. Professor Brennan, I'm truly grateful for your time today. Thank you very much for joining.
Thanks, Rob. Thanks for having me.
So, to start off our questions broadly, what is the impact of the current coronavirus on cancer treatment in Ireland at present? And why do we need to worry more about cancer patients than the rest of the public?
Well, I think it's important, Rob, in this situation to be very clear that the coronavirus is having a major impact on the whole country, but particularly it's probably causing a lot of anxiety for people who have either recently been diagnosed with cancer or who are currently receiving treatment for cancer, and of course those who are in the follow-up period afterwards. At present, it's important to reassure people that we are still treating patients with cancer. We are having to change the way we do that in certain cases, and we'll probably go through that in more detail as things go on. But even though obviously a huge amount of the health service is actually devoted at present to the management of the COVID-19 crisis, we are still working looking after cancer patients, and we're always there to look after our patients, whether it's in person or, as you know yourself, more recently via the telephone. I think the reason that people, both doctors, all healthcare professionals and patients, are a little bit more worried about the coronavirus, particularly with regards to women and men with cancer, is that there is some suggestion that anybody that has an impaired immune system will develop more significant problems if they do become infected with coronavirus. So it's very, very important that patients with cancer adhere to the guidelines that we'll discuss later on, but also that their family do, because that has really changed not only how we practice medicine, but how we live our lives. And I hope that what we'll hopefully do today is bring a little bit of enlightenment to people, but also some reassurance that we are there to look after them and we will continue to treat them.
Great, thanks for that. So I suppose burrowing down into some of these things and some of the challenges that people are having and indeed reporting to us, we're seeing lots of advice for different groups of people, different groups of cancer patients. Some of it seems to change or be changing, and it can all be a bit overwhelming and confusing in that. So could you bring me through, and you've touched on it there in your initial answer, could you bring me through some of the different groups and different people and how they're being impacted and how the recommendations apply particularly to them, maybe starting with people who are on active cancer treatment at the minute?
Yeah, thanks. Yeah, so I think it is important. It is very daunting at the moment, isn't it? Because things are changing on almost a daily basis, and everything we say today could be different in a week's time. So we have to be careful of the fact that we have to continue to communicate with our patients. I suppose, as you know, in Ireland at the moment, we have come into a phase where we're in very clear guidance for the entire population with regards to social distancing and this term called cocooning. And one of the questions that we get asked all the time is who should cocoon? So from a cancer perspective, anybody over the age of 70, whether they have cancer or do not have cancer, should be cocooning. And what we mean by that is that they need to stay within their own home, and they need to limit any face-to-face contact with others as much as possible. But of course, they should also do all the other things that we're asking people to do, which is wash their hands regularly, use what we call cough etiquette, where they sneeze into their elbow, and avoid touching their face if they can at all. With regards to cancer patients at present, the guidelines are, as you say, always changing, but women and men who are on active cancer therapy at the moment, particularly those who are receiving chemotherapy or immunotherapy or targeted treatment, which, as you know, may often be a tablet and not be the classic chemotherapy that people are used to, they should continue to cocoon, and that's very important. Likewise, people who have ongoing treatment for cancers of the blood or the lymph glands, particularly leukemias, lymphomas, or myeloma, And the reason there is, of course, that they often have very impaired immune system. We do know that the biggest problem with COVID-19 is the fact that it affects the lungs. So any patient with lung cancer, and particularly those who are being treated with radiation at the moment, need to cocoon. And also any patient who's recovering from a bone marrow or stem cell transplant particularly over the last 6 months. Of course, there are many people with cancer who have other conditions as well, and we need to remember that. So people may have diabetes, they may have severe asthma, or they may have what we call chronic obstructive pulmonary disease, or COPD. And these groups obviously need to take that into account as well. And of course, there are people too who may have cancer, or maybe on treatment of cancer, but may have other conditions such as multiple sclerosis or rheumatoid arthritis and be on medication, which may impair their immune system. So they also have to be aware of the fact that they need to cocoon. But on a basic level, anybody whose immune system might be impaired at present needs to consider cocooning. And then, of course, there are the people who maybe have completed their treatment or are recovering from their treatment or their surgery. And at present, they need to at least adhere to the guidelines for the population, and really on a case-by-case basis try and avoid as much contact with other people as possible. Of course, this is very difficult, but this is the only way that we will actually stem the virus. And we do know, unfortunately, that if the virus does, if people who have just been recently treated for cancer, whether that's surgery or chemotherapy, develop the virus, they can develop quite significant complications.
And I suppose then if someone had a question, maybe if they're on active treatment, they might go to you or their clinical team. And if they're not on active treatment, maybe their GP or some other healthcare professional. Would that be fair?
Yeah, I think the most important thing is to try and contact people by phone, so that they should phone their GP or phone their local cancer centre. Or of course, we have our amazing cohort of cancer nurses, nurse specialists. It is important to remember that unfortunately, many people are being reassigned to different duties at present, and our cancer staff are often reduced. Particularly our nurse specialists have had to go back to do probably work that they wouldn't have done previously. So it may take some time for people to actually get back in touch with patients from time to time. So we would ask the people who are patient if they can be at all.
Sure. So should patients with cancer treatment, should they still attend their clinic then for their appointments?
So this is very much on a case-by-case basis, and we are doing our best, and I hope that people are being contacted. We're trying to reduce the number of attendances to the hospital, and really that's because we want to protect our patients, particularly those with cancer, from bringing them into a situation where they may be brought into contact with the virus. And the virus, of course, you can get one of the biggest, highest risk group of people with the virus whom you can get the virus from, unfortunately, are healthcare professionals. Mm-hmm. So we have to be very careful that we try to reduce our interaction with patients. And we're not doing that in any sort of a mean way. We're actually doing that to try and protect our patients. Patients who are having what we would call first-line treatment, whether that's surgery, radiation, or chemotherapy, they will continue to attend their clinics, but that might be different than what it was before. They may attend in different places, and they will be their appointments will generally be confirmed a day or two before their actual visit. And then those that are on follow-up for surveillance, they will nearly all nowadays be done for the time being by telephone or video conference. And I suppose it's very important to reassure people that there actually is a big movement internationally to move towards these sort of virtual follow-up clinics to try and improve people's quality of life in general. And there have been a number of studies showing that they're just as effective at picking up recurrences as compared to coming to a hospital and sitting in a waiting room for 2 hours to see a doctor for 15 minutes. Having said that, we all need to change the way we work as a result of this virus, and we will be changing how we follow people up. The most important thing that we need to do when we're following cancer patients up is to listen to their symptoms. And oftentimes there's a huge emphasis put on scans, but in fact, symptoms are much more important than scans. Mm-hmm. And nearly always the trigger to do a scan in a patient is in fact their symptoms, rather than doing routine scans as part of follow-up. So patients may feel that there's scans that they were due to have every 3 months may have to be extended out. In fact, that's probably entirely fine and maybe a legitimate way to look after patients going forward. But any patients in follow-up who do declare symptoms suggestive of a recurrence of their cancer, we will organise for them to be seen in the hospital on an urgent basis.
So would it be fair to say then that you're saying that there will be some changes to people's treatment plans in terms of maybe contact before their appointments, some screening maybe as they come into the hospital, some appointments being rescheduled, and so on? And how would you reassure someone that might be worried about that impacting their care?
Again, that's absolutely true, and this will happen, and this may happen now for a number of months. This is not something that's going to change over the next few weeks, and even if restrictions are lifted at a national level, it may well be that within hospitals this sort of practice will have to continue. Lots of things are changing. For example, the areas where cancer patients are being treated may be changed. The hospital may even change. For example, there are some, as you know, some of the private hospitals have been taken over as public hospitals now, and therefore people who used to go to the public hospital for their treatment will now be going to the private hospital, the building, to have their treatment done, whether that be to give their chemotherapy or to have their radiotherapy. It's important to reassure people that we've done this so that we have really kind of divided hospitals into COVID and non-COVID areas, because it's so important that we continue to treat people who don't have COVID-related disease, and cancer is a very important part of that. People at the moment may find that their medication may be changed, and they may be moved onto tablets. They may have a reduced number of cycles of chemotherapy, and then we may spread out the time between their chemotherapy. For example, people may have been on weekly chemotherapy, and we may move that to 3 weekly chemotherapy. A lot of the studies that have been done in these areas show very marginal benefits in these different regimes. And of course, these studies have never been done in the setting of a major pandemic like this. So the most important thing, everything we're doing at the moment is aimed around patient safety, trying to protect the men and women with cancer to try and minimize their risk of contracting this COVID-19 infection. Some people it will be suggested that they might even consider a treatment break, particularly if their immune system is very low or something like that. And a lot of the assessments, as I said, again, even for those on treatment, will be by phone where possible, again, trying to allow people to cocoon as much as possible. So it will be a big change, but everything that we're doing at the moment is to try and protect all of those people on treatment and provide that treatment in a safe manner to reduce the risk of them developing complications as a result of this.
So you're aiming to reduce complications, but also maintain the same expected outcome. Would that be a fair summary?
Yes, absolutely. And we have to be very clear in the fact that because we've done things in one way for many years, we often change how we give treatment. We often change how we schedule treatment, whether it's we do surgery first or we give chemotherapy first, and these things change from time to time. It's just the fact that everything has changed so quickly that people may be getting quite frightened by that. Our main issue here is to treat the patient, not the disease. And that's why we're instituting these different changes. But we are continuing to give chemotherapy, we're continuing to operate on patients as necessary, and we're, of course, continuing to provide radiotherapy.
So I suppose a very basic question, if I was a cancer patient and I was coming in to attend your clinic, what kind of precautions might I take to reduce my risk of me either catching COVID illness or potentially bring it into the hospital?
So again, we've been very clear about this, and this applies to all people who are coming to a hospital, whether it's for a cancer visit or for a cardiology review. If you have any symptoms of the COVID-19 infection, we would ask that you phone ahead, and we will most likely ask that you do not come to the hospital. And those symptoms really, as many people will know now, are a fever greater than 38 degrees, a cough, shortness of breath, but also any flu-like symptoms like pains in your muscle pains. And now we are seeing some more atypical presentations of COVID, particularly with things like gastroenteritis or nausea and diarrhea or vomiting. So any kind of, unless you're feeling really well, we would like to hear about it before you come to the hospital. Likewise, if you've had any close contact with anybody who has tested positive for the condition, we will probably want to delay your attendance to the hospital because we want to again reduce the risk of you being put at risk of either contracting the condition from us or spreading it elsewhere. And then, of course, we're asking you to do the same things that we're asking everybody to do elsewhere. Stay 2 meters away from people as much as you can. Wash your hands regularly. You will see that there are literally hundreds of alcohol stations throughout the hospitals now for people to wash their hands. Cough etiquette, and obviously some people are asking whether they should wear a mask or not. At the moment, the recommendations are that we don't think that you have to wear a mask if you're not symptomatic of the disease. But as you know, this is all changing from time to time, and that may change over the next few days, weeks, or months.
Okay. So for someone who's been recently diagnosed with some form of cancer, but not yet been given a treatment plan, they haven't started to really get into the system, what can they expect now, and how might the COVID situation impact the timeline for their treatment?
Yeah, so that's obviously something that's causing a lot of anxiety, and I can understand why. As I've said to you, we're still treating cancers. We're still operating on men and women with cancer. Basically, whenever a patient is diagnosed with a cancer, their case is discussed at what's called a multidisciplinary meeting. Mm-hmm. And that's a collection of cancer specialists, medical oncologists, surgical oncologists, radiation oncologists, pathologists, and radiologists. And we assess the patient's history, their biopsy results, and any X-ray tests that they might have done. And based on that, we will make a decision about what treatment they should have. Now, as a result of all the things that are happening at the moment, the decisions that we are making are slightly different than what we were making 3 months ago. And therefore, there are times when we will suggest that patients maybe should defer surgery until after the COVID-19 crisis has at least settled. But we are offering alternative treatments in that situation. So, for example, there are some people with breast cancer who maybe started on hormone treatment before their surgery now, rather than having an operation and starting hormone treatment afterwards. And there are studies to show that that is safe. Likewise, there are people who may, on a risk-benefit basis, maybe decided to bring them into the hospital to have an operation, and that will happen. And that's happening quite quickly now. And then there are other people who have decided whether they should start chemotherapy based on maybe they haven't had an operation, or whether they should have chemotherapy before an operation. These things are really being decided on a case-by-case basis, and they're being decided very clearly. And I need to reassure people that we are holding all our meetings, all our MDTs are going ahead. Many of them are going ahead like this in a virtual fashion, so that we don't have groups of doctors congregating together, and therefore we won't lose staff. And we're really making the decisions, particularly around major surgery and chemotherapy, based on the individual patient's tumor itself, whether it's a high-risk tumor. And remember, not all cancers are the same. Some are high risk, some are not as high risk. Some, there can definitely be a role to hold off surgery. So, for example, in my own specialty with endometrial cancer or cancer of the uterus, we are treating an awful lot of those patients at the moment with hormones. And we know that for up to 6 months, those patients have the exact same outcome as if we operated on them straight away. So we're changing it from time as we go along. We do have access to surgery, but we have to be careful that we can't sometimes do really big operations, because we don't really want to be in a situation where a patient might have to be transferred into the intensive care unit, because that may not be available at the moment. So everything has been based through the MDT. And once that decision is made, those treatments are starting. They're starting within a normal time that we would expect them, and oftentimes that can be between 3 and 6 weeks.
Okay. So if I had worries about cancer, maybe I found a lump or unusual bleeding or something, or if I was worried, maybe I'd already been treated for cancer for a few years and I was worried that it might come back, should I get checked, or can the system deal with that at the minute?
Absolutely. And this is a very important message that many people are trying to get out there, not just in the cancer field, but life goes on despite COVID-19, and people get non-COVID related problems. People will have heart attacks, people will have strokes, and people will get cancer, and people will get recurrences of cancer. And it is hugely important that those people that have any symptoms that worry them, that they contact their GP. And remember, the GPs will see patients, but they need to be contacted beforehand to actually to schedule that. And that likewise, here in the hospitals, we are more than happy to, as I said to you earlier, see patients who have symptoms that are suggestive of either recurrence or, in some cases, a first presentation. Any sort of abnormal bleeding, any abnormal persistent pain, any weight loss, any cough, particularly a cough that's bringing up blood in patients who may be at risk of lung cancer. These are things that are very important. Obviously, we're advising people to continue to self-examine, particularly with the fact that some screening tests aren't available at present. It's very important that women continue to perform self-examination of their breasts. It's very important that anybody that notices anything that they're worried about, that they contact their doctor. We are open and we're available, and we're more than happy to see people. And we do have access to ways of diagnosing people if we need to, whether that's with X-ray, with biopsy, or, as I said, with surgery. So if you have a symptom that is worrying you, please contact either your cancer care, whether that be in the hospital or in the community, or your GP if you haven't had a history of cancer but you have symptoms that are worrying you. We need to be very clear about that, because we are afraid that there are people sitting out in the community not presenting with these symptoms because they're scared that they might get COVID-19. We are now set up to look after these patients.
Okay. So I think we'll wrap up there. I suppose, have you any final words of advice or anything in summary for people that are worried about cancer issues at this time?
I think the most important thing is that we are still open. We're still looking after people. Things have changed, and things might continue to change. So I would advise that people, adhere to the recommendations that are being put out there by our public health teams. I'd also try to advise people to be wary of some of the things that are out there on social media. This is a major problem at the moment, as you know, across many different disciplines. So please, if you are getting information about cancer, get it from reputable sources. I know the Irish Cancer Society website, and there are many other places like that where we can get that information out there. Or talk to your GP. And of course, you can contact the Irish Cancer Society Cancer Support Line as well if necessary. But if I can just reiterate, Rob, that it's so important that if people have symptoms that they're worried about that are not related to COVID-19, that they please contact either their GP or their cancer care team, and we will look after them.
Okay, I want to finish up there, Professor Brennan. I want to say a big thank you again for your time. I know it really is a challenging time for you and the team. It really is very reassuring to have your world-class skills and support, and the whole team, the Mater and all of the other hospitals around the country. And please pass on our gratitude to your colleagues and wish them and their families the very best at this time. A reminder, what Professor Brennan said there as well, the Irish Cancer Society support line is open every day to help anyone worried or affected by cancer and looking for information on any cancer-related issue, including concerns around coronavirus. We're also providing support on financial and employment matters, and we're supporting people and arranging free cancer counselling. So people just have to call. The number to call is 1-800-200-700, or they can look at our website, cancer.ie. So thank you very much for listening in. And again, thank you very much, Professor Brennan.
Thank you, Rod.